too long ago. This was an empty building, and the city donated it to Senior Spectrum, and very, very proud to see what has been done with it. The daycare facility is absolutely tremendous. In Waterville, we've taken a great pride in working with our elderly. Our police department has a program that touches base with elderly that live in their homes. 2 years ago, when fuel oil was at $4 a gallon, we got a bunch of volunteers headed by the United Way, and we made calls every day to make sure that people who were seniors in their homes had heat, food, and medication, and made sure that they were all right. It behooves us to work very hard at allowing people to live in their home as long as possible. One of the things as mayor of the city that I encounter is that every year elderly are forced to come for abatements because they live on fixed incomes. Heat is so expensive, food is so expensive, and medication is so expensive that we need to pay attention. I believe it is up to a family to take care of its family. We believe in taking care of our parents. We believe in taking care of our children. I think we need more of that, and it's an attitude more than it is anything else. We can make it work here in Maine. It's all about prioritizing where we spend our money.
Mr. Scott.
Good morning. I'm Kevin Scott. Thank you all for coming. I want to thank the M4A, the Maine Area Association Area of Aging agencies, as well as AARP for sponsoring this event. The question is, Maine is spending 9% on in-home care funding and 91% on institutional. What will I do to change that? Well, you have my commitment that I will advocate and work closely with our legislative leaders and the folks who represent the area agencies on aging in understanding what a realistic expectation is for turning those numbers around. We may not get to 91% funding for in-home health care, but we're going to move that number up. It's critically important for the long-term health and well-being of our seniors to have in-home care. And just as importantly, it sets a standard, and it begins to cultivate and shift an attitude away from increased runaway medical service prices and institutionalized care programs. That's what I will do for you, is I will advocate strongly that we work on changing those priorities. An important piece of that, we look at our welfare dollars that we spend here in the state of Maine, and a lot of the candidates here today have rolled out a plan, one or another, about what they might do there. Well, you know, it's just these types of occasions when we have to really focus on what we're thinking about when we're thinking about reforming the habits of folks that need help. And in Maine, you have to work and seek work to receive TANF benefits, food stamp benefits, and those things. I will create a program. I will work with our legislature, and we will work to create an environment where those folks seeking work for benefits will work with seniors in home, and we'll train people, and we'll get it done. Thank you.
Libby, what would you do to put more money into home and community-based programs?
Thank you for having us here today, and thank you for that question. Life is truly about choices. You have a big choice to make about the next governor of Maine, but it's not just choices for seniors. I certainly am a strong advocate for that. It's also about choices about everyday life and family values. And let's talk a minute about people wanting to stay in their homes. The number you just quoted is staggering. Over 80 to 90% of the seniors polled would like to stay in their home. That's not a news bulletin to all of us. If you talk with seniors around the state, they will tell you that. My mother wanted to stay in her home, and she was able to do so until her very last dying day. I want to stay in my home just as long as I can. We need to push the envelope and to make sure that policymakers know that the best place for those elderly who want that choice is in their own home. But once we increase the funding level, shift the balance, more than 10%, let's move that up to 15 to 20. It's not going to happen overnight, but we need to push in that direction and not eliminating the other choice of assisted living. That's important to many people as well. But remember, as we do allow seniors to stay in their homes, we have to provide the support services, like the area agencies on aging do. Whether you're providing home-based care, Meals on Wheels, sometimes to stay in your home, you need just a little bit of support. Homemaker services have been at risk in the last budget cuts, but you need these support systems to allow you to stay in your home. And what could be more important? I really don't want seniors to be seen as people who should be treated differently. You're part of the state of Maine. Your choices are as valuable as anyone's. And if your choice is to remain at home, frankly, it's better public policy. In many ways, it's going to save dollars, but it's also going to add dignity to a person's life.
Thank you, Libby. Second question goes to Elliot Cutler. It is estimated that 14,000 Maine seniors are victims of elder abuse, neglect, and exploitation. What would you, as the next governor of Maine, do to address this growing problem?
We've had a problem in Maine with domestic violence of all sorts, including elder abuse, including spousal abuse, for years and years and years. My mother, who I spoke about in answer to the last question, helped found Spruce Run, which is the center in Bangor, one of the first, if not the first in the state, that is and was a shelter for abused women and their children. But the problem of elder abuse is underreported. It's underreported, it's underknown, it's undermonitored. One of the greatest steps we ever took in the state of Maine, thanks to the Maine Medical Association, I know Gordon Smith is here today from the MMA. One of the most important things we did in the state of Maine was when Bob McAfee was president of the American Medical Association. He was from Maine, from a doctor from Portland. And Bob made sure that at the top of the AMA's agenda was the issue of domestic violence. He made sure that physicians all over the country were reporting, monitoring, looking for evidence of abuse. We need to do the same thing now with respect to elder abuse. And elder abuse is not just violent, it's also financial. There is an extraordinary amount of financial abuse of elderly, often, horribly enough, by their families. Horribly by their families. And the only way that we're ever going to remedy these circumstances in the state of Maine is to make sure that we're all aware of the problem, that we're looking for evidence of it, that when we see it, we report it, and that we take care of the people who are the victims of that abuse.
Mayor